We're working right now with a multicenter study trying to demonstrate how phosphorus MR spectroscopy, which is a technique that is similar to the MR imaging, uses the same machine, can help us to demonstrate prediction of response in patients with non-Hodgkin lymphomas, specifically diffuse large B-cell lymphomas. We do a study before they are treated, and it's a non-invasive technique. We don't need to inject, we don't need radiation. We see what is chemically happening in the tumor. And there are two chemicals that we study, and those two chemicals, depending on concentration, can help us to know if the patient is going to respond or not to treatment. Yes. Okay, we are studying diffuse large B-cell lymphoma, which is a very aggressive type of lymphomas. And in those patients, before they start their standard treatment, which is R-CHOP, is a very standard treatment based on anthracyclines. In these patients, we study them before they're going to receive the treatment. We see what is happening in their tumor. We see the chemistry of the tumor. Basically, we see two signatures which are named phosphoethanolamine and phosphocholine, which are related to the synthesis of membranes. And if those molecules are high, above a threshold of 2, the patient is not going to respond to the standard treatment. And if those molecules are below 2, then the patient will respond to the standard treatment. We are right now trying to prove that point to be able to use this in a clinical setting and take these patients that are not going to respond to standard treatment to other treatments that will help them to resolve the cancer. Our results is that basically patients that have low phosphoethanolamine and phosphocholine are prone to have a longer survival time without the tumor. Or in other measurements that we did, they are having a long complete response to treatment. Long-term complete response means that they will have more than 6 months of no presence of tumor in their body. And with that, we can demonstrate that our measurement is possible to be used clinically, because if the patient has a large concentration of these molecules, then it will not respond to the standard treatment. Well, as I mentioned it before, the implication is that with a non-invasive methodology that uses a machine that is already ready in every hospital, we are able to demonstrate if the patient is going to respond or not to treatment. So when you have a patient that is not going to respond to treatment, you know it beforehand, then you can avoid the cost of the treatment that is going to be unnecessary on the patient, is not going to be effective. You improve the possibility of giving the patient a better treatment that is going to be helpful for him or her. And the clinical implication is that you have the chances to direct the patient to a treatment that will be more effective on the patient. First, we need to really prove it in a larger population of patients with non-Hodgkin lymphoma, with diffuse large B-cell lymphoma. We also want to have it done in other types of lymphomas to see if it works in the same way. And these signatures are present in all the tumors. There are many studies before us, done in vitro studies and in vivo studies, and they have demonstrated that even in tumors that are very strange or tumors that are very common, you have these signatures. So there is some commonality. And we're thinking that the best way to do this study is to continue studying other types of tumors to see if we can also demonstrate the clinical use of these signatures that we see in phosphorus MR spectroscopy.